Good morning, Phil. We have Mr. Yuhan Chen is a 32 years old male admitted to surgical ward post laparoscopy and appendectomy. He is a non-English speaker with a history of obstructive sleep apnea and has BMI 42. He underwent an emergency laparoscopic and appendectomy. He refused post-op 2 liters of oxygen and he received 10 milligrams of indone since admission. He is non-ambulant and awaiting review from the physiotherapist. And we're going to assess his vitals and the document the QS form. Um, Good morning, Mr. Chen. My name is Elisa, and I'll be looking after you with my colleague Phil today. We might just going to check your observation real quick because you look a bit unwell.
Yeah, I'm a bit concerned because his SpO2 is 88% on room air. Respiratory rate is 30. Heart rate is 102. He's drowsy and diaphoretic. His QAD score is 6. This is a significant deterioration. I'll get help. Early recognition of deterioration is critical. QADS is a validated tool that helps nurses identify when a patient needs urgent escalation. Drowsiness in this context is a red flag for respiratory compromise. For high risk or post-operative patients, especially with the OSA and obesity, we must be vigilant with the opioids and always escalate if in doubt. Interpreters should be involved at every step to ensure safe and patient-centered care.
All right, let's set him up in floor position and start oxygen. I'll call the team leader to let her know about the current situation, and the team leader might prepare to escalate if needed.
Yeah, I should position the patient upright, elevating the head of the head at least 45 degrees to help maximize thoracic expansion, enhance the diaphragmatic movement, and improve ventilation. 2 liters nurse-initiated oxygen is applied, starting with nasal prongs and supplementary oxygen order awaited after RMO review. Interpreter services are used to explain interventions to Mr. Chen. Um, Interpreter, can you help me to interpret to Mr. Chen? Hey, Mr. Chen, you are having trouble breathing. We are giving you oxygen to help you. Let me assess your airway breathing, circulation, and I would encourage you to take slow and deep breath, please.
Hello, this is RN Elisa calling from the surgical ward. We have a post-op patient, Mr. Yuhan Chen, and his QS score 6 and SATs 88, and also due to the respiratory rate 30. He's a bit drowsy and he's got history of OSA and obesity, post-laparotomy, and received 10 milligram endone. We start oxygen and position him upright. We need a urgent review.
Yeah, I'll escalate this to the RMO to urgently review, okay? And then we'll continue nurse initiated oxygen and keep him in Fowler's position and repeat ops.
Thank you.
Hi, is it Dr. UM?
Hi, this is Dr. Yu from the RMO. How may I help you?
Hi, it's Asa, team leader of surgical ward. We have a
Mm-hmm.
post-op patient, Dr. Yuhan Shen, QAD
Mm-hmm.
score of 6 and oxygen 88%,
All right.
respiratory rate 8. He's a bit drowsy and got a history of OSA and obesity, post-laparotomy, and received 10 mg of endone. We have started oxygen and positioned him upright. We need urgent review.
All right, I'll be there shortly. Thank you. Good evening, guys. My name is Yum Khosla. I'm the RMO. Are you both the nurses looking after Mr. Yuhan Chan? Can you tell me
Yes,
a bit more about him, please?
yeah, sure. My name is Elisa, and we have Mr. Chen, and he's 32 years old male, post-appendix perforation repaired, and his BMI is 42. He's
Mm-hmm.
got a history of OSA, and he's a non-English speaking background.
Mm-hmm.
He refused oxygen earlier this morning, and now his stats is down to 88. We recheck his respiratory rate is 30 per minute, and he looks a bit drowsy to me. After we giving him like 10 milligram endone.
Okay.
QS score 6, and we start the oxygen and repositioning him. Yeah.
All right, that's good. So first of all, we're gonna change his nasal prong and we're gonna shift him to high flow nasal prongs oxygen at 40 liters per minute. And later on, we titrate the oxygen once he's tried to get settled down, like his vital signs get to try to settle down. I'll also order an arterial blood gas to check his blood pH level, the partial oxygen and partial carbon dioxide. On top of that, I'll order a chest x-ray to assess the chances of hypoventilation, pulmonary edema, and more. In the meantime, I'll withhold the further opioids use since opioids are known to exacerbate respiratory symptoms in person with OSA and obesity. Instead, we'll put him on patient control intravenous analgesia acetaminophen. All right? I'll do the whole ordering and stuff. In the meantime, please try to keep continuous monitoring, like 15 minutes vitals, and update me if you have any deterioration. Thank you.
Thank you.
I'll make sure the interpreter is available for all communication and will document all interventions.
Yeah. Hi, interpreter. Can you please translate this to Mr. Chen? Hello, Mr. Chen. We're going to give you a strong oxygen and watch you closely. Your breathing is getting better, and that's pretty good. If you feel worse, please press your call bell.
We are also monitoring Mr. Chen's oxygen saturation and vital signs every 15 minutes. Pain will be managed with the non-opioid options for now. We are also using the interpreter to keep him and his family informed, which is vital for culturally safe care.
Ring, 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 ring. Hello, am I talking to the TL of surgical ward? Hi, this is Yum Kosla, the RMO. I just received the results back for Mr. Yuhan Chen, the 32-year-old male. So his result shows impaired gaseous exchange due to filling of fluid in his alveolar capillary membrane, which is hindering his exchange of gases. My plan for him is to continue him on high flow oxygen, try to start chest physio, once safe, redo ABG to assess for positive results for our interventions, have an interpreter to help him translate everything required. Try to keep the ICU informed. If SpO2 drops or his conscious level is changed, please don't hesitate activating MedCall. Thank you.
Thanks, doctor. Hi, is it Eliza, the RN looking after Mr. Yuhan? Hi, Mr. Yuhan has been diagnosed with impaired gas exchange and RMO has advised continuous monitoring. Continue high flow oxygen, start chest physio once safe, and redo ABG. If his situation declines, activate MedCall, and in the meantime, I'll let the ICU know about our patient's situation for further administration for further continuous evaluation.
Understood. We'll keep our equipment ready and update you with any changes, and I'll brief night staff and ensure clear documentation. We will acknowledge Yuhan and his family about the situation and intervention. Also, the further process with help of the interpreter, and we are adhering nursing standard, ensuring mutual respect, understanding, and transparent communication. Thank you.